All right, welcome back to ABA exam review, where we're going through our fourth BCBA practice exam. Today, we're going through the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. If you're looking for our proven study materials, check out behavioranalyststudy.com. We offer practice exams, a study guide, and of course, our famous combo pack. When you pass your exam, please let us know so we can include you in our Sunday shout out. Other than that, let's work hard, study hard, get to our questions. 151. Greg needs to pick me up after lunch during his workday. He is unsure if Dr. Pepper, Red Bull, or coffee provides him with the biggest energy boost. He only wants to drink one per day. What type of analysis should he conduct? Now, when we're talking about comparative, component, and parametric analysis, we need to understand that each are its own distinct thing. Typically, component and parametric are lumped together, while comparative kind of sits on its own. With the comparative analysis, we're looking at interventions, or in this case, drinks, that aren't in a package. So they're not related. They're not joined together through a treatment package. They're just kind of standalones. And we're going to compare each one by one and see what's most effective. With the component analysis, we actually have a treatment package, and we're going to look at each component of that treatment package individually and see what's effective or what is not effective, right? So we're analyzing each component of a package. And that's the main difference between the comparative analysis and the component analysis. Comparative, they don't really exist in a package together. With the component analysis, we have a full treatment package, and we're going to look at each individual item in that package one at a time. Now, when you get to parametric analysis, you've identified your component, and now you're going to ask yourself, how much do I need? It's basically the dosage. If you've identified the medicine that works for you, then you need to identify how much medicine do you need. If you've identified the reinforcement that works for your client, how much reinforcement do you need? That's the parametric analysis. So you need to understand all three of those. In this case, Greg is looking at Dr. Pepper, Red Bull, and coffee, and he's only going to drink one per day. He's not forming this treatment plan. He's not forming this package. He's just looking at which one is going to be most effective. So if we're not forming a package, if we don't have a package already in place, and we're just evaluating each individual thing, that's going to be a comparative analysis. There's no variability analysis associated with what we're trying to do here. As long as you can understand the difference between comparative, component, and parametric, these questions should be pretty straightforward for you. A research assistant tells the class that the null hypothesis says that the intervention will not decrease the frequency of the behavior. The intervention in question will begin next week. The research assistant's statement reflects which of the following. This is a goal of science question. And our goals of science in ABA, description, prediction, and control. So what is this research assistant trying to accomplish? Remember, we want to do all our work up front. Well, she knows, or she says, that her hypothesis is that the intervention will not decrease the frequency of the behavior. And we know the intervention she's talking about is going to begin next week. Therefore, this intervention hasn't actually taken place, but she has a hypothesis. So what is she saying, or what does the statement reflect? A, description. A description, you're just describing the phenomenon, right? We're describing what we see, we're describing a behavior, we're describing the phenomenon, essentially. She's gone past that point and is now making a hypothesis. She's now predicting there's a possible correlation between these things, right? There's a correlation she's predicting between her intervention and the frequency, and that the intervention, her null hypothesis says the intervention will not decrease the frequency. So the hypothesis is going to say the intervention will decrease the frequency. So she's just predicting what is going to happen. Control is going to be hopefully demonstrated the following week when she begins her intervention. So description comes first. A comes first. It's not A. Description, we're just describing the behavior we're seeing. We're describing empirically what we're seeing. We are on the prediction stage, or the research assistant is on the prediction stage because she's hypothesizing possible correlation. She's predicting what may happen once she starts introducing her intervention. The following week, she's going to attempt to demonstrate control. And control is when we have that experimental control between our IV and our DV, right? Her intervention is affecting the behavior, and she can control the behavior through the intervention. So the research assistant statement is reflecting which of the following? Well, B, prediction. She's making her prediction about what's going to happen with the intervention. Next week, again, she's going to try to demonstrate control. 153, Claire is taught that the word bell matches a picture of a bell. Claire is then taught that the picture of the bell matches a real bell. Finally, Claire is taught the real bell matches the word bell. The last pairing represents what? Careful here, right? It's a stimulus equivalence question. We've got to be very careful when identifying aspects of stimulus equivalence, right? Transitivity, we know, is the highest order, okay? Transitivity occurs when behavior or pairing or equivalence are derived from symmetry and reflexivity. So when we have symmetry, we have reflexivity, we have these other matches derived from those two. In this case, we have the word bell, which can be A, matches a picture of a bell, which is B. So that would be A equals B. She's then taught that picture of the bell, B, matches a real bell. So B equals C. Claire is then taught real bell matches the word bell. Now, the problem here is Claire was taught. This was not derived. Derived implies untaught. And it's only true transitivity if the behavior is derived. In other words, if the behavior is untaught. So the last pairing doesn't actually represent transitivity. It definitely doesn't reflect symmetry or reflexivity, right? Because we have an A equals C situation. But since it was taught, it can't represent transitivity. So the last pairing represents none of these. Make sure you understand that. It's a tricky concept, right? Stimulus equivalence is already difficult. Symmetry, reflexivity, transitivity is already challenging. But what you need to remember, in order to achieve true transitivity, you've got to understand that those pairings, right, the final pairing, that A equals B equals C, A equals C, that transitivity has to be derived, not taught. 154, the behavior analyst becomes pregnant with her first child. She is going to take 3 months maternity leave starting in April. Her caseload is quite large, and she is not sure if her company will be able to handle her absence appropriately. What is the analyst's role in this scenario? What do we have occurring here? We have this analyst who is now pregnant. She's going to take maternity leave starting in April. So she's taking 3 months maternity leave, which is a substantial amount of time, especially in applied behavior analysis land, right? If you're delivering service, 3 months is an eternity, okay? So she knows her caseload is large, but she's not sure if her company can handle her absence. What is her role? And that's the key here. The question is asking about the analyst role in the scenario. A, since the analyst works for the company, it is not her obligation to ensure her company can handle her absence. Now, what would the ethical code say about that? And you need to ask yourself that from here on out. What would the ethical code say about that? Well, of course, you should know the ethical code does not imply that she has no responsibility in the continuity of services. That just, of course, isn't the case. If she's got this large caseload and she's gone for 3 months, there are steps she needs to take to try to ensure her clients aren't harmed and that they somehow resume services. B, the analyst must cut her maternity leave short in the event that her clients will not receive service. Well, not necessarily, right? Again, we have her ethical code. As long as this analyst is acting with her best foot forward and best faith and doing her best to try to ensure continuity of services, that's the best she can do, right? She's under no obligation to take less maternity leave to continue providing services. C, the analyst needs to communicate what steps they're taking to make sure service is not interrupted. Yes, this is the next step they need to take, right? It is their role to attempt to facilitate continuity, whether through transitioning her client somewhere else, transitioning to another analyst, whatever steps she's taking, she needs to communicate to the family, she needs to communicate to the company. And there are other things listed in the ethical code that she needs to do as far as what needs to be written in the contract, that sort of thing. But first and foremost, the analyst role, if you're going to take a leave of absence, if you're gone for an extended period of time, first and foremost, you need to communicate with all relevant parties that you are taking necessary steps ensuring service is not interrupted. And then D, the company is responsible for facilitating the continuity of services. Well, whether that's the case or not, the question is asking about the analyst role. And that's where your mind needs to start going, right? The question is asking about the analyst. They are talking about the company in D. D should not take up a lot of time in your head evaluating it because it's got nothing to do with the analyst. And that's where they'll get you on the test sometimes, okay? The question they ask and the answer choice they provide have nothing to do with each other, but you might spend a lot of energy and time on that answer choice. That's why it's so important to do your work up front, understand what the question is asking, and then hone in on that. So, what is the analyst's role in the scenario? Well, the analyst needs to communicate what steps they are taking to make sure service is not interrupted. 155, a tutor is going through flashcards with one of her students. She records that the student got 8 flashcards correct in 1 minute. What might be a better measurement to use for flashcards correct? Well, if the question wants a better measurement, then that means or implies we're already using a measurement. So what kind of measurement are we using right now for flashcards correct? Well, it says the student got 8 flashcards correct in 1 minute. That essentially is rate, right? Frequency over time, 8 flashcards per minute. Now, the question is asking what's going to be a better measurement to use for those flashcards correct? The problem with rate for something like this, and what Cooper will say, is that if there's a discrete trial, rate is tough because it's not going to be a true indicator of their rate since someone else is controlling that SD, right? Someone else is controlling the presentation of flashcards, okay? And that's the key here, why something else might be better in this case than rate. So A, trials to criterion. Well, sure, if we have a mastery in place, right, this student needs to get 9 correct in a row, right, to achieve mastery. That's probably a better measurement than how many they can do in 1 minute because there's a lot that can affect how many flashcards that are even delivered in that 1 minute if we're going to use rate. B, percentage of opportunity. This is pretty good, right? What if the first minute 10 cards are presented and they get 8 right? The next minute 15 cards are presented and they get 11 right. That percentage is going to tell us probably more accurately rather than, well, the first time they got 8 in a minute, the next time they got 11. Well, the second time they only got more flashcards because more flashcards were presented. So that needs to make sense to you, right? So trials to criterion is going to actually imply a mastery setting. Percentage of opportunity is going to take into account the fact that different amounts of flashcards might be delivered. So percentages might change. C, duration. Duration is not going to really help, right? Because we have our duration. We have time, 1 minute. Duration of doing flashcards is not going to really give us a clear indication of their accuracy, right? Or the percentage correct. Duration is not going to be better than rate. Rate is still better than duration given what we need to know, which is a aspect of frequency. But what is going to be better might be a trials to criterion or a percentage of opportunity. So our answer is going to be D, both A and B. 156, when deciding on the magnitude of change in a changing criterion design, which of the following is true? Now, we've asked similar questions about changing criterion designs because in experimental control, you need to know the benefits of using each experimental design, I should say, the benefits of using each design, how we can find or establish functional control with designs. You have to know the intricacies of the designs. That's what they're looking for, okay? Not just surface level. In this case, the magnitude of change in a changing criterion design. What do they mean by the magnitude of change? Well, what they're meaning is from step to step, how much are you increasing or decreasing the requirement, right? If your first step is run 5 minutes, and then your next step is run 10 minutes, your magnitude of change is going to be that 5-minute change. That's what they're saying. So which of the following is true about the magnitude of change in design? A smaller change indicates larger experimental control, but the change should not be too small. So that's just not correct, right? A smaller change is not going to indicate larger experimental control. A larger change is going to indicate experimental control because in a changing criterion design, the behavior should follow the changes of the criterion. So each step, that behavior should follow each step. So a larger change is going to indicate larger experimental control, but the change should not be too large. Yes. B is what we're looking for. A larger change is going to demonstrate more experimental control, but we need to be careful. I'm not going to go from 5 minutes of running to 30 minutes of running. It's unrealistic, right? The chance of failure is very high. C, a smaller change indicates larger experimental control and the magnitude does not matter. Well, we know the smaller change does not indicate experimental control. And D, a larger change indicates larger experimental control and the magnitude does not matter. A larger change does indicate larger experimental control, but the magnitude does matter. So our answer choice here is B. You've got to read very carefully on these type of questions, right? Everything is kind of repeated over and over again. First glance, seems like a pretty straightforward question, but it's very easy to get lost if you're rushing. These are the ones you need to slow down on, the quote-unquote easier ones, okay? You want to get these ones right. Which of the following concepts would not be conceptually systematic when discussing a recent change in behavior? Okay, let's think about what conceptually systematic means. Conceptually systematic means we're adhering to the principles, the concepts of applied behavior analysis. And the reason we do that is because applied behavior analysis can be used in all kinds of different modalities and all kinds of different segments and sectors. And there's so many different uses for applied behavior analysis, but we need to ensure, no matter what we're using ABA for, is that we continue to use principles and concepts of behavior change. In this case, it's asking about which concept would not be conceptually systematic. So we're looking for one of the concepts here that isn't going to be consistent with our literature or our behavior analysis concepts. A, extinction. Well, of course, extinction is conceptually systematic, right? It's one of our behavior change principles. B, non-contingent reinforcement. Non-contingent reinforcement is an empirical intervention used in ABA, so it's fine. C, unmotivated. Now, when we talk about motivation in ABA, how do we talk about it? Well, we talk about motivating operations, we talk about establishing operations, we talk about abolishing operations, but we don't use the term unmotivated. So using this term unmotivated is actually not conceptually systematic when talking about recent change in behavior. And then D, establishing operation. Yes, establishing operation is conceptually systematic. It's consistent with the literature. It's consistent with the research. It's consistent with what we talk about or how we talk about behavior change. We don't use unmotivated. It's not conceptually systematic when talking about our change in behavior. 158. One of your trainees is going over non-contingent reinforcement with a stakeholder. The stakeholder asks whether the type of reinforcement and the function matter when delivering non-contingent reinforcement. How should the trainee respond? As a behavior analyst, you may have to supervise trainees, you may supervise technicians, and it's going to be your job to train and provide feedback. So you've got to get comfortable doing these type of things. And if you evaluate a trainee who is giving parent training advice or giving advice, you need to be comfortable identifying what's wrong potentially with what they're saying. In this case, they're talking about non-contingent reinforcement. The stakeholder wants to know whether reinforcement and the function matter when delivering NCR. How should the trainer respond? So you need to ask yourself, does the type of reinforcement matter and does the function matter for non-contingent reinforcement? If we're delivering this reinforcement non-contingently on a schedule, does the function matter and does the type even matter? A, as long as reinforcement is delivered according to the schedule, then function and type do not matter. That's just not true, right? It's still going to make a difference what type of reinforcement we use and what the function is. We still need to know the function of that behavior, and we still need to reinforce, hopefully based on that behavior or that function. B, the reinforcer should be a maintaining reinforcer, but the function does not matter. Well, we're getting closer. A reinforcer should be some type of maintaining reinforcer, because if we're delivering a reinforcer non-contingently, but it has no effect on behavior, it's not even a reinforcer, right? It's not going to act and not going to change anything, okay? C, any type of reinforcement is okay as long as the function is identified. Well, not necessarily. If you identify the function as attention and you start providing all these tangibles non-contingently, not really going to have the desired effect, right? The whole point of non-contingent reinforcement is usually an abolishing operation. And then D, the reinforcer should ideally be maintaining and match the function. Yes, in a perfect world, you need to identify the function. So if the function is escape, well, then our reinforcer should maintain the behavior to escape. It's going to match the function. And we need to non-contingently find a way to deliver escape. So if you're going to use non-contingent reinforcement, the reinforcer should be maintaining and it should match the function of the behavior in question. 159, while chatting with one of your supervisees, you mentioned that you need to buy a new pair of jeans for the spring. Supervisee knows your birthday is coming up, so they surprise you with a pair of jeans from your favorite store. Is it okay for you to accept this gift? Interesting, right? We just changed, or the BACB just changed the gift code, right? What we can and can't accept as far as gifts go. And the new rule is $10 on a non-regular basis, essentially, right? That's our gifting thing. Now, that's for client and stakeholders. Do those same rules apply to supervisees, right? Because you're chatting with one of your supervisees, and the rules for relationships are sometimes different for supervisees and trainees. So if your supervisee knows your birthday is coming up, they buy you jeans, what do? Do you accept that gift? A, yes. Since the supervisee is not a client or stakeholder, there are no rules for gifts. Well, that's untrue. The ethical code dictates or stipulates the same rules are for clients and stakeholders apply to supervisees and trainees as well. So everybody has to follow the same rules because we're trying to avoid those dual relationships and conflicts of interest. B, yes, since this is a one-time gift. Still, if a pair of jeans, unless that pair of jeans is somehow less than $10, you shouldn't accept it. C, no, supervisees are not allowed to give gifts. Not true. Supervisees can give gifts using the same guidelines that clients and stakeholders must follow. And then D, no, supervisees must follow same rules regarding gifts as clients and stakeholders. Yes, that is the answer we're looking for. This supervisee is still required to make sure the gift is less than $10, and that is not on an annual or a routine basis. As long as they follow those rules, you can accept that gift. 160. Which experimental design is most susceptible to multiple treatment interference? Now, multiple treatment interference says that one treatment is impacting others, right? So the data is going to look possibly skewed. Maybe the data is just not going to be accurate because treatments are interfering with each other. And if you think about it conceptually, the answer to this question makes sense. Which experimental design do we have a lot of treatment going? Are we implementing a lot of treatments at the same time? A, withdrawal design. Well, withdrawal design is going to be actually a way to avoid this because you're going to implement one intervention and then withdraw it. Implement something else, withdraw it, right? So there's not a lot of multiple treatments going on at the same time. B, multiple baseline designs. Well, in multiple baseline designs, you're typically using the same intervention across people, settings, or behaviors. So there's not really a risk of multiple treatment interference. C, multi-element design. Yes, in a multi-element design, we're rapidly rotating between treatments. There's a good chance that each treatment might affect the other. And then D, changing criterion. And changing criterion, we have a single intervention we're using, trying to increase or decrease the behavior. So what experimental design is most susceptible to multiple treatment interference? Well, the answer is going to be C, multi-element design. Great. Check out behavioranalyststudy.com for all of our study materials. As always, let us know when you pass so we can include you in our Sunday shout out. Work hard, study hard. See you soon.